Includes 2 trips to Vietnam for me. I and others like me are tired of liberals and conservatives bassing each other in Washington, D.C. This isn't about parties. This is about the country. We are tired of you and others putting party and Nancy Pelosi's directives above what is good for Iowa. Cap and trade is not good for Iowa citizens, and I think you should have voted against it. The health care bill is not good for Iowa, and you have to choose, sir. Clearly, we would be well served by health care reform in our system, but there are ways to do that that don't take us to socialized medicine into systems that are not serving England and aren't serving Canada and other countries, and I will leave you with some written suggestions that Ahanyak has.
Good. Thank you very much. I appreciate it, and I'll be glad to have it. Oh, excuse me. Go ahead.
I don't want government intrusion into my life. I don't want my medical conditions public information. And by the way, I haven't seen a doctor in 10 years. I want to help citizens who need a leg up through no fault of their own. I don't want to fund medical services for illegal aliens. I don't want a national health care system where there are those that are exempt from the plan, which includes unions, federal employees, and Congress. That's 25% of the population. That's 80 million people, and you're only trying to provide health care services for 40 million that are uninsured. I want to choose my health care, and I want to pay for it as I can afford to. And I don't want that plan out of business trying to compete with the government. I just want the government to leave me alone.
Yeah.
Question of you, sir, is when you go back to Washington in September, simple yes or no, will you vote for any of the 3 health care plans that are currently before the House?
We don't. I can't answer that. But we don't have it. We don't have a bill.
You got 3?
No. We don't. No, we got 3 drafts, and they've got to be melded together. So just, and then when that's done, then you ask me the question. I'll give you your answer.
Will you read it?
Absolutely. I've been working on it since the 14th of July. And so, right away. But first off, just a couple things. Did you say 2 tours of Vietnam?
Yes, sir.
Yes.
You and me. Me too. So maybe we ought to visit sometime. I would enjoy doing that. We have an employee that's from Bung Tao, and he's a wonderful young man that was put out in one of those boats when he was 10 years old. Mm-hmm. I went back to Vietnam last December the first time, so maybe we ought to visit sometime.
Okay.
But anyway, on the subject of keeping the government out of our lives and some of the things that you said in your remarks, someone came up to us not too long ago and was pretty upset, like, I understand that, you know, worried about the health care and so on. So don't you get government into my health care, kind of like what you said. Then they turned to walk away and they stopped and said, and don't you mess with my Medicare either. And then they took a few more steps, and they stopped, took a few more steps, and they said, and don't you mess with my Social Security. So I appreciate where you're coming from. You know, we want the least possible, but let's just take a hard look at this and see what we come up with, and then I'll answer your question. Alexis, where are you? I lost you again. Please.